Hello everyone, I'm Gangani Ariyala. This presentation is about our research on ADHD identification using convolutional neural network with seed-based approach for fMRI data. This research project was supported by University of Moratuwa, Sri Lanka. Before moving to the research details, let's have a brief introduction to our research work. Simply, attention deficit hyperactive disorder, which is commonly known as ADHD, is a consistent pattern of inattention, hyperactivity, and impulsivity, which is at a higher rate compared with the other control groups. Recent statistics have shown that 7% of the entire world population has ADHD, while 6.4 million children of age between 7 to 14 in United States are also suffering from ADHD. ADHD has high risk of comorbidity. The comorbidity disorders such as depression, learning disability, oppositional defiant disorder, Tourette syndrome are some of the most common comorbidity disorders that ADHD patients are suffering from. There is no still there's no clinical system to identify ADHD. Therefore, early detection and identification of ADHD is important to prevent severe symptoms and difficulties in executive functions. As I mentioned earlier, even though there are some manual procedures to identify ADHD, there's no clinical system to identify ADHD. Therefore, ADHD is known as underdiagnosed disorder. Uh, as well, ADHD has high risk of child patient with ADHD continue to have the symptoms for their adulthood also. So these facts motivate us to start a research like this. Let's move into the technical literature. There's a related study on discrimination of ADHD based on fMRI data with deep belief network. In there, they have introduced a deep learning based approach using deep belief network, and there the limitation is it has limited accuracy values obtained for overall and brain region wise ADHD identification. In 3D CNN based ADHD classification study, they have examined a 3D CNN model on diagnosis of ADHD, but there the limitation is they have considered the functional and structural MRI data separately, and they didn't explore the joint information there. In the machine learning approach for classification of ADHD adult based study classify the adult ADHD using the EEG data, but there the limitation is that is only applicable for adult data. In extreme learning machine based classification, they have in that study, they have established an automatic and efficient ADHD classification method using extreme learning machine. And there the limitation is they have only considered the structural MRI data in the study, which used the fully connected cascade artificial neural network architecture. There, they have demonstrated the utility of FCCANN architecture for classifying subject with ADHD from typical subjects. There, the limitation is they have done the comparison with only the SVM classifier. In the discrimination of ADHD children based on the Bayesian network study, they have come up with a novel method to combine the belief network with Bayesian network, but there the limitation is it only applicable for specific brain areas. So this, in our research, we try to overcome these limitations. Let's move into the data set. For our research, we have used the fMRI dataset. That dataset is provided by ADHD 200 Global Competition, and that dataset contains data from 14 children and adolescents aged between 7 to 18 years. And the dataset was released by New York University Child Study Center. This image shows the sample functional MRI dataset that we have used, and This image shows the 3D brain image along with the time series. And here this is our system overview. Initially, the fMRI data was applied for pre-processing techniques. There we have applied the techniques of normalization, motion correction, slice time correction, band pass filtering, co-registration, which will be discussed more detail in later on the presentation. And then the pre-processed data was applied for feature extraction and selection. Therefore, for feature extraction, we have used seed-based correlation. Then the pre-processed and feature extracted data was applied for deep learning model. As deep learning model, we have used convolutional neural network, and then the generated classifier model was evaluated using accuracy, precision, recall values, and finally classified the results. The classification using fMRI can be discussed under data preprocessing, implementation, and evaluation. Data, as I explained earlier, for data preprocessing, we have mainly used four main techniques. And the first one is realignment. There we have calculated sum of square difference between images to remove movement artifacts by realigning the fMRI image time series. In the slice time correction, we have done the slice time correction by shifting the signal pace by temporary aligned data, and the slice acquired in the middle of the sequence. It was applied to adjust the values in the image by making the all voxels appear as they were taken in the same time. And the normalization, we done the normalization by stretching, warping, and squeezing image using mathematical approaches to reduce the size and shape effect of the brain. Then we have applied the co-registration by image matching and image interpolation. Uh, that was done to register different types of images from the same subject. Finally, we have applied the technique of smoothing by averaging every voxel with a weight, and we have used the Gaussian kernel. It was applied to increase the signal to noise ratio. Then for the implementation, we have applied seed-based correlation for feature extraction. It denotes the functional connectivity between seed or region of interest, and it estimates the relationship between seed regions defined based on different anatomical locations than other brain regions. The connectivity is calculated based on the time series of seed voxels. Then the significance of the research come in the data augmentation. We have done the data augmentation by random rotation, height shift augmentation, and horizontal flipping. Here, as you can see, this is the CNN architecture that we have applied. We have mainly considered the default mode network region as it was identified as the most significant brain region for ADHD patients. This is our evaluation results. We have evaluated DMN regions, and there we have mainly considered four main regions: PCC, LTG, RTJ, and MPC. There in the phase one, we have applied pre-processed feature extracted data, finally applied for classification, and we have evaluated that evaluated it there that are displayed in phase one accuracy values. In phase two, we have applied data augmentation. There we have obtained better accuracy value than phase one. We have also obtained sensitivity and specificity value. Comparing those values, we have obtained the highest accuracy for MPC region, which is about 85% accuracy. As a conclusion, our research paper is mainly focused on the effect of the main brain region in default mode network, and We have obtained the accuracy of 85.21 for MPC region, and this result shows that our study address the limitations, and it shows a superior in performance to the previous studies. And as a future work, we can combine the psychophysiological data such as eye movement, EEG, to acquire high accuracy values for ADHD classification. For any clarifications, you can contact me on my email address, which is displayed in this slide. Thank you.